So, good day everyone. It's me again. And didiscuss ko ngayon is about measles or known as Rubeola. In the last video, didiscuss natin yung about sa chickenpox or varicella. So, next naman yung didiscuss natin ngayon is about measles. So, it is an acute contagious and exanthematous disease that usually affect children who are susceptible to upper respiratory tract infection. As you can see, sinirkalan ko yung contagious, ibig sabihin, our measles is easily transmitted to other person. Hindi na niya kailangan ng direct inoculation para maka-transfer or maka-spread to other person. Pero kahit walang wounds or cuts, nakaka-transfer pa rin siya sa ibang tao. Nakaka-infect pa rin siya sa ibang tao. So, for the etiologic agent, we have the Paramyxoviridae. Yun yung nagko-cause ng measles natin. Source of infection, secretions of nose and throat of infected person. Mode of transmission natin, nakakahawa siya through droplet spread, direct and indirect contact, and airborne. So, 3 things na dapat malaman ninyo sa airborne, ito ang MTV, which is yung measles, tuberculosis, and varicella. Itong tatlo, ito yung mga can be transferred from another person through airborne. Yun. Kaya lang mag-suspend and tumagal sa air. Ganon. So, our incubation period is 8 to 13 days and usually about 10 days. So, our period of communicability, nagsisimula siya before the prodrome and lasts until 4 days after the rash appears. So, prodrome means it is the general symptoms or non-specific symptoms. Ganon. So, next is our pathognomonic sign when it comes to measles. Tinatawag natin siyang Koplik spots. Ito yung white spots sa buccal cavity natin. Yun. So, pag tinanong sa board exam, what is the pathognomonic sign of measles? Ang sagot, Koplik spots. So, we have 3 stages. Number 1, the pre-eruptive stage, kung saan makakaramdam yung patient ng fever, catarrhal symptoms. These are the rhinitis, conjunctivitis, and coryza. When we say coryza, it is the runny nose. And we have the Stimson's line. It is the red line on the lower conjunctiva. We have the eruptive stage. Nandito na yung makikita natin yung maculopapular rash, high-grade fever, anorexia, and yung throat is red and extremely sore na talaga siya. And convalescence stage, mawawala na yung rashes, magsasubside na din yung fever, magkakaroon ng discrimination, and yung symptoms mawawala, and mare-restore yung appetite. Kasi since masakit yung throat, talagang mawawalan ka talaga ng appetite doon. Okay? So, our diagnostic procedure, we have the nose and throat swab, urinalysis, blood exam, which nagpapakita na mataas yung IgM or IgG. Kasi itong dalawang ito yung usually na tumataas if there is a inflammation inside our body. Our treatment is antiviral. Drug of choice natin is the isoprenosine. take note, drug of choice natin sa measles, it is isopranosin. Also give antibiotics as ordered and oxygen inhalation and IV fluids. Our preventive measures, meron tayong vaccine dito sa Pilipinas and we called it the anti-measles vaccine or the AMV or the MMR. So, 2 doses siyang binibigay. First dose, binibigay siya 9 to 11 months. And second dose, binibigay siya ng 12 to 15 months old. Ganun. And 0.5 ml siya. And through sub-Q sa outer portion ng upper arm natin. So, measles vaccine, hindi siya binibigay sa pregnant, sa may active tuberculosis, leukemia, lymphoma, and depressed immune system. Bakit hindi binibigay sa mga buntis? Because yung anti-measles natin or yung MMR is, yung meaning ng MMR, di ba, is measles, mumps, and rubella. And take note, yung rubella natin, it is the German measles. Yung rubella, sobrang maliit kasi siya. And kaya niyang makalusot sa transplacental barrier. Sa placental barrier. And pwede siyang makapasok and pwede niyang maapektuhan yung baby. Kaya nga yung German measles natin, it has a teratogenic effect. And also take note, our MMR, it is a live attenuated vaccine. Ibig sabihin, buhay na buhay yung virus na ipapasok sa katawan natin and that triggers our immune system to develop antibodies to attack those virus. So, pag ibibigay natin to sa patient na may immunocompromise or mababa yung immune system niya, hindi makakaproduce agad yung immune system niya ng antibodies to counterattack those virus. Okay? Gets ba? So, our nursing consideration is to maintain standard and airborne precaution. Place natin also yung patient in negative pressure room. I think na maalala kong meron to sa question. Pero hindi tinanong. Pero meron to sa situation sa question kung saan sinabi na yung patient is nasa negative pressure room siya. Ganon. So, pag hindi niyo alam yung negative pressure room, good thing napanood nyo tong video kasi sasabihin ko kung ano yun. So, negative pressure room, lahat ng communicable disease, dapat ilagay natin sila sa negative pressure room. Ibig sabihin ng negative pressure room, hindi makakalabas yung air na nasa room palabas ng pinto or ng bintana. Hindi sila lalabas. Kasi kaya natin linalagay sila sa negative pressure room para hindi makalabas at maka-infect ng ibang tao. Ganon yun. So, aside from the negative pressure room, meron din tayong tinatawag na positive air pressure room. Ito yung hindi makakapasok yung air sa room na yun. And itong positive air pressure room para to sa patient na bagsak yung immune system niya. Para hindi makapasok yung contaminated air papunta sa room and magkukus pa siya ng infection sa patient natin. Ganon. Okay, so since our patient na may measles are photosensitive, kailangan natin ng proper care sa mata ng patient natin. And daily elimination na din. And pag may fever yung patient, magbigay tayo ng fruit juice, milk, and milk and water. Ganun. To avoid dehydration. And pag in-order naman ni Doc na magbigay tayo ng penicillin, magbibigay tayo. And tipid sponge bath, skincare, and ear care, gano'n. And lastly, pinaka-importante sa lahat, isolation. Para hindi makahawa sa ibang tao. Sa communicable disease, as much as possible, minimize natin yung mga positive cases natin. Bawal, ay, hindi naman bawal, pero as much as possible, hindi dapat dadami yung may positive cases. Kasi it can lead to pandemic, ganun, epidemic, ganun. So, that's all for our measles or Rubeola. Tandaan niyo lang, measles may O. Ibig sabihin, Rubeola. Kasi German measles is rubella siya eh. Medyo nakakalito yun. So, always tandaan ninyo yung measles may O. Ibig sabihin, Rubeola. So, that's it for measles. I hope you learned something from me. And don't forget to like, share, and subscribe. And ring the notification bell below para ma-notify kayo sa mga bagong videos na ipopost ko. So, good luck to your board exam and you can do this. Kayang-kaya nyo yung MP1 na yan. So, goodbye and thank you.